right, let's continue. So we're talking about the names of the muscles and specifically, again, skeletal. Skeletal, so muscles connected to bone. So if we look, let me move this back. So trapezius, deltoid, rectus femoris. Again, rectus means it's erect. The fibers are going straight up and down. Femoris, where the femur is. So that's part of your quadriceps. Sartorius is in the front, tibialis anterior, pectoralis major, pectoralis, biceps brachii, external oblique, external. On the outside, oblique, the fibers are running at an angle. So your abdomen, you really just have 4 muscles, which is a strange thought. It's skin, fat, muscles, okay? 4 sets of muscles. It's the rectus abdominis, it's the transversus abdominis, and it's the obliques, the internal and external obliques. And then after that, you're in the abdomen, okay? And then we're looking at the intestines and so on. So gastrocnemius, again, that's your calf muscle. Again, it gets named gastrocnemius, because it looks like a little belly, okay? By the way, muscle, myo, that we're talking about muscle. Where did it get its name from? They look like little mice, right, under the skin. Something's moving under the skin. So that's where it gets its name from. So whenever you see that prefix myo, we're talking about muscle. So the soleus is in the foot, in the leg, not in the foot, in the leg. Triceps, latissimus dorsi, so those lats. Gluteus, we're talking about the behind here, gluteus medius, maximus. Biceps femoris, again, that's in the thigh, in the back there. Semitendinosus and membranosus. And what I was saying was, these 3, those are your hamstrings. So the 3 in the back are your hamstrings in the thigh area. The 4 in the front are the quadriceps, okay? And then the Achilles tendon. All right, so the process, what do muscles do? The process of skeletal muscles and how they move. Okay, so again, I'm gonna go to this picture because again, a picture is worth 1,000 words. Okay, when muscles work, think of your biceps, okay? So when muscles work, what they do is they contract. They get shorter. So as they work, they get shorter. And that's the way they work, okay? And muscles work in groups generally. So biceps, there's 2 heads. They work together to shorten this way. Triceps, there are 3 heads. They work together to go this way. And usually you have a movement one way. And so those muscles shorten to get that movement. Then these muscles shorten to get that movement. And so the muscles that are working together to get a movement are called synergists. The muscles that work together to get the opposite movement are called antagonists. And usually, whatever movement we have, we always have synergists for having one action and antagonists for having another action. So that's what we're talking about here. Muscles, nerves function together. Yes, that's physiology. Skeletal muscles perform in groups are classified as follows. So antagonist, primary mover, synergist. So the biceps are synergists working for flexion. In this case, the triceps would be the antagonists working for this action, right? And muscles work together. So that's what it was talking about. Muscle, yes, the body of the muscle is the main portion. The origin and the insertion, you hear that a lot in anatomy. So again, we'll go to our biceps. So they're going to be attached to the bone, The area where there's less movable bony attachment, that's the origin. The area where there's more movable bony attachment, that's the insertion. So think of your biceps. If these worked, they'd go, right? So you'd have flexion, okay? This is the less movable bony attachment. So that's the origin. Oh, there it is, point to origin. This is the more movable bony attachment, because if you look, right, and that's the insertion. And then flexion is the action, because when you move up, the angle here gets lower. All right, so yes, so the bony, the origin, the insertion, tendon is what is connective tissue. That's what connects the muscle to bone. So yeah. And then muscles work as a lever system. So if we have levers, they physically, right, with physics, lever systems help the action. Okay, you guys, in this book, they don't talk about levers, but now smooth muscle, okay? Smooth, oh, they don't have a picture. Okay, so smooth muscle, again, think of hollow organs. So around the bladder, around the intestines, around the blood. Involuntary, because you don't consciously think about contraction, right? So not controlled by the conscious part of the brain. Under the control of the autonomic nervous system. We haven't gotten into the nervous system yet, but auto means self, autonomic. So that's part of the nervous system that just works on its own. So you're not consciously thinking of making this happen. Like, think of your heart rate, think of respiration. Yes, you can consciously go, but all day you're breathing, right? And you're not thinking about that. So that's under the autonomic nervous system. So includes muscles of the internal organs, digestive, respiratory, urinary, plus muscles of the eye and the skin. So you're not thinking about that stuff. Cardiac, again, only one place in the heart. Myocardium. Myo means muscle. Cardio, we're talking about heart. Involuntary, again, under the control of the autonomic nervous system, again. And then there's specialized tissue. Yes, it's muscle, but it has some own muscle tissue that can generate contraction, which is really special about the heart. Yes, contraction can occur even without an initial nervous input because of the pacemaker cells. So there's a special place in the heart. It's called the SA node or the sinoatrial node, and that generates electrical impulses to get the contraction going. Yes, they have to have a lot of blood. Cardiac blood gives nutrients, gives oxygen for the muscles to work. All right, so it talks about as we get older, we get tired more frequently because of the cardiovascular. Yes, muscles are involved in movement, okay? And then posture and producing heat. Now, the end of this chapter is talking about some kind of pathological issues, talking about some medical issues. Don't want to think about it sometimes. If you think about it, so that starts on page 182. So, and just like before, there are these terminologies related to this system and some of the common issues, right? So here it shows common sites of amputations. Again, just the thought of it sounds horrible, right? But yeah, okay, if that's needed. Lipoatrophy. Atrophy is like wasting away. So if there's wasting away of the tissue, then building your medical vocabulary. I'm just going to go ahead here. Sometimes people, their tendons get inflexible and the muscles, it's just hard for them to move. And that's where they talk about this. Dermatomyositis. So derm, we're talking about skin. Myo, we're talking about muscle. Itis, we're talking about inflammation. So it says acute, I'm just going to read what it says in your book. It says acute chronic diseases with systemic pathology, inflammation of the muscles and the skin, a connective tissue disease characterized by edema. Edema means swelling. Dermatitis, so inflammation of the skin and the muscles. So it occurs in children and adults. Okay, all right. Now, this is a really good picture. If you think about breathing, what are the muscles involved with breathing? I don't know if you've heard of that. If you're a singer or if you're a musician, you hear about breathing and taking a big breath, okay? When you take a big breath, it's not just your chest that goes up. Your abdomen kind of goes down too, kind of to fill that chest. while the diaphragm is a skeletal muscle involved in breathing. And then the intercostals, between costae, we're talking about the ribs. The intercostals are involved with breathing. So all of that, if you can think of this as a big barrel, right? So inspiration and then expiration, and then these muscles are involved. Okay. Fibromyalgia. I don't know if you guys have heard of fibromyalgia. It's kind of wild. It's wild how, medicine changes. So 20, 30 years ago, I had a friend who had fibromyalgia, and doctors said it was all in her head. And now we realize, no, it's not. It's just really complicated. There's stuff we just don't know, which is okay because we just don't know. It doesn't mean it's not happening. So it's an autoimmune issue. It says, this is on page 187, disorder with chronic, so it's happening over and over and over again, widespread musculoskeletal pain and fatigue. So those are the, symptoms. Yes. So pain and fatigue. Other symptoms include sleep disorders, irritable bowel syndrome, depression, chronic headaches. Although the exact cause is still unknown, fibromyalgia is often traced to an injury or physical or emotional trauma. There's no cure. There's just trying to work on the symptoms. And then this is showing some of the tender points with fibromyalgia. So you can look at that. MD, muscular dystrophy. There's a picture in your book, right? Muscular dystrophy. Okay. It affects the muscles, weakens the muscles. It says this young boy with muscular dystrophy needs receive tube feedings, home nursing care. He attends school when possible. What does it do? Okay. It's a horrible disease. Again, we don't have a cure. Okay. It says it can affect people of all ages. No specific treatment exists. Physical therapy, orthopedic appliances, corrective orthopedic surgery could be needed to improve quality of life. So in the book, this is on page 189, they go into it, refers to a group of genetic diseases. So that genetic component comes in, characterized by progressive weakening, degeneration of the skeletal or voluntary muscles that control movement. The muscles of the heart and some other involuntary muscles are also affected in some forms of MD, and a few forms involve other organs as well. So you can imagine if the cardiac and the respiratory go, that's not good. Okay. Okay. So they talk about how to diagnose MD. So they talk about that here. They talk about patient positions. This is really neat. This starts on page 193, goes to page 194. Some of the, sometimes you need to position patients to do different procedures. So you guys could take a look at that. Yes, prosthesis. You hear about knee surgery. You hear about hip surgery. This is the hip, right? Here's the iliac. So here's the ball of the femur, right? It's called the acetabulum. And then here is the socket. And sometimes the whole prosthetic, right? They actually use like cement. It's like glue to cement this into the bone. Now the drag about hip replacement or knee replacement is it wears out over time. So after 10 years, they have to do it again. Okay. So usually they don't jump to do total knee replacement or hip replacement really early in life because they know they're going to have to do it again and they're going to have to do it again. And they don't rush to do that. Here, this looks nasty. It's a tumor, but it's benign. Usually it's benign. What does that mean? It's not cancerous. So they could cut it out, get rid of it, and the person's going to be okay. And skeletal muscle relaxants, some of the drugs, diagnostic tests. So you guys can read about the diagnostic tests, some abbreviations. You guys can read about that. And then that finishes up the chapter. Okay. Again, be really wise. Okay. Doing the homework, doing the MyLab activities, and look at the study and review. Really, the study and the review is going to guide you as to, what's the test going to be on? What are the things that are going to be on the test? All right. I wish you well. Hope you have a great week. Talk to you later. And remember, next week we're going to have an exam.